Cape Cod Broadcasting weaves the listening environments of 99.9 WQRC, Ocean 104.7, WFCC Classical 107.5, Cape Country 104, and CapeCod.com's website experience to reflect the lifestyles of the people who live, work, and play on Cape Cod. We hope that you enjoy this podcast.
I'm Laura Reckford, and this is Sunday Journal. I'm here in the studio with Heidi Nelson, who is the CEO of Duffy Health Center, and Dr. Omar Ghoneim, who is the Corporate Dental Director at Harper Health Services. Welcome to the show to you both.
Thank you, Laura. Good to be here.
Now, we're talking about community health centers, and it's in honor of National Health Center Week that's coming up. But before we get into the main issue here, let's start with getting a background on each of your agencies. Heidi, let's start with Duffy for some of our listeners who might not know about Duffy and what it is.
Sure. Duffy Health Center, our mission is to improve the quality of life for people who are homeless or unstably housed on Cape Cod through a blend of medical services, mental health and substance abuse counseling, and case management for people who have the greatest challenges finding and keeping housing. Over the last 12 months, we served 3,200 people here on the Cape.
A large number. I think people would be surprised to know that number, so thank you for including that.
Mm-hmm.
And Omar, can you do the same with Harper Health Services and also give us a little bit of your background?
Yeah, so Harper Health Services has 5 community health centers. We also have a WIC program and an ESP program. And one of the sites, Geiger-Gibson Community Health Center, was the nation's first community health center. We have our 50-year anniversary coming up this coming December, which we're excited about. We also have another site in Neponset, and the other sites are in Hyannis and Harwich, and we opened up a site in Plymouth last March. And a lot of, what's been behind sort of our growth has been based on the need in all those areas. And, it's definitely prevalent here on the Cape in terms of, patients needing care, certainly in my arena for dental services. And, this year alone, with the fiscal year that just ended, we had over 44,000 visits, and a third of the visits across Harper Health are for dental. And a bulk of those are basically along the Cape and Islands.
Again, large numbers there with how many people your agency services. We have this Community Health Week coming up. And Heidi, maybe you can sort of frame the issue for us of what community health centers are and what part they play in the community.
Very good. We have 5 health centers that serve the Cape and Martha's Vineyard. So the two of us who are here today are in a network with Community Health Center of Cape Cod, which their main site is in Mashpee, and they serve the Upper Cape. And our colleagues at Outer Cape Health Services, they primarily serve the Lower and Outer Cape. And our newest little brother health center is Island Health Services. They have been a rural health clinic on Martha's Vineyard for a number of years, and just within the past 2 years have received the federal designation and federal funding. So those are the 5 health centers, and combined we serve upwards of 50,000 patients on the Cape and Islands.
What is a community health center? How is it defined?
So our mission is to serve people, provide health care to people who are in need of health care with no regard for their ability to pay. So we all have to define a service area, a geographic service area, or in Duffy's case, a target population of the homeless. And we have to do outreach to the community. We have to have consumer representation on our board of directors. So it's a wonderful model. As Omar said, it's been around now for about 50 years and grew out of that Office of Economic Opportunity and the efforts in the 60s to kind of involve people in their own care is a really big principle that we follow at health centers.
And Harper Health, Omar, as you were saying, it really plays a big role in the history of community health centers, and you referenced that, but maybe you could fill us in a little on that.
Yeah, as Heidi referenced, Dr. Geiger and Dr. Gibson were physicians and, came up with the neighborhood health center concept based of what they saw when they were in South Africa and brought that here. And I think the benefit to people and patients, and certainly the patients that we serve and treat in our communities, is you have medical care all under one roof. And certainly with the Affordable Care Act and, the move towards trying to coordinate care and make it much easier and seamless for patients and providers, it's, you're able to provide more coordinated, comprehensive care for patients with, better communication with providers, particularly when you're talking about different disciplines, whether it's medical, dental, behavioral health, which we also provide, optometry, podiatry. And I think for a lot of patients, it takes away a lot of the logistics and communication barriers that exist, which are burdensome for all of us, but certainly a lot of the patients that we treat and care.
And for Harper Health, I believe you just recently opened an office in Hyannis, but you have other offices located around the region.
Yeah, we've been in Hyannis since, I believe 1982.
Oh, not
and
recent.
we
Okay.
Well, but we new address, so that is correct. So we relocated last June the 2nd, I believe, to our present location, which is on Addicks Lane, and it's a much bigger, more accommodating site. And we've also been in Harwich since 1982? And again, we just opened up a site in Plymouth in March of last year.
So several different centers around the region. Now, when we're talking about healthcare, what often comes up are accessibility issues. Can people get to centers? Is that part of the role of community health centers?
Absolutely. So part of our needs assessment needs to be around where our sites are located, and we have to be very strategic about that. For example, with Duffy Health Center, a significant percentage of our patients are patients who stay at the NOAA shelter. They're guests at the NOAA shelter. And so in 2008, we applied for a federal grant to start a mobile health clinic. So we have a bus that says Duffy Health Center on the side of it, and we go to different locations around the Cape. But importantly, even though the shelter is only 0.6 miles away from our main health center site, there are still some clients who stay at the shelter who are reluctant to make the trip and come into the big building. So we go on Tuesday and Thursday evening, taking the van with a nurse practitioner and a nurse, and we go inside the shelter and treat people at that location. That's just one example of how we try to minimize barriers.
And for Duffy, it's specifically, as you said, for people who are homeless or who have issues along those lines.
So about 75% of our patients are people who the average person might not consider to be homeless. So one of the features of homelessness on Cape Cod is that we have a lot of hidden homeless. So mom and kids, she loses her job, she can't pay the rent, moves in with her sister. She's eligible for Duffy services because we consider that to be homeless. And there are other examples of people living in unauthorized cottages and basements, and they are eligible for Duffy services.
Some people use the term couch surfing, where people are going to different people's homes, and then they don't have a permanent residence. They're in between residences,
That's
if
right.
you will.
Surfing is fun, so I don't like to use that word because being homeless is not fun. But yes,
good.
That's a term that's often used.
Very good point. And Omar, in terms of Harper Health, is it really for people who don't have health insurance, or can anyone go? Tell me who are the basic clients for Harper Health?
Yeah, good question. Much like Heidi referenced, we are in need areas in terms of targeting and providing services for patients and participants that need our services. But the reality is we provide care for anyone, and one of the benefits is a lot of individuals don't know what they're eligible for. So we do insurance enrollment, have them meet with a financial counselor to see what they're eligible for. Whether it's Medicaid, I'd say the vast overwhelming majority of the patients that we treat in dental have Medicaid. But there are a fair number of patients that don't have benefits, whether they're elderly, unemployed, seasonal employees that can't afford dental insurance. And the benefit with coming to us is they will pay based on their finances. So they'll sit with a financial counselor and be able to find out what they're eligible for, and then we'll work with them to be able to provide the care that they need.
So anyone can walk in. They don't have to be necessarily from the town of Barnstable. They can be from the Cape, or is it restricted?
For us, it isn't. So that's consistent with the mission with Harper Health. We do not turn away any patient. So certainly any patient patient that comes in, we will see. Some health centers, because of the capacity issues, one of the reasons why we have so many sites along the Cape and Islands is there are patients in need of treatment. We don't have a waiting list. So, in fact, with a lot of our sites, we'll have patients come hour and a half, 2-3 hours away because they have nowhere else to go for care and treatment. So I think, again, with Harper Health, part of our mission is being able to provide care to those that need it.
But we are, Laura, trying to move away from the idea of being an indigent clinic where people just walk in and have a one-off kind of experience. We're all moving toward a designation called patient-centered medical home, which means that our health center is the place where you are receiving all of your health care services. And so walking in is not really a concept that we think about. Some health centers are set up to do urgent care if somebody has an immediate health care need. But really what we want to do is have people come in, register, be oriented to our services, and know what it means to be a part of a patient-centered medical home. How do you get hold of your doctor after hours? How do you get an appointment if you're feeling sick today and you don't want to have an appointment 3 weeks from today? You want to have an appointment today. How are you engaged in your own health care, in working with yourself on your chronic disease management? So it's really a whole philosophy where we're moving toward a more comprehensive approach.
Very holistic, dealing with all aspects of health care for the person. I'm Laura Reckford, and this is Sunday Journal. I'm talking with Heidi Nelson from Duffy Health Center and Dr. Omar Ghoneim from Harper Health Services about community health centers. Now, are community health centers always nonprofit, or how does the funding work?
So community health centers do have to be not-for-profit organizations. Interestingly, on the healthcare for the homeless side, there were and have been a number of programs that have been started by hospitals and started by public health departments in different cities and towns across the country. But by and large, community health centers are not-for-profit human service agencies.
And I'm sure there are funding issues, as we see in many nonprofits. Omar, can you speak to the funding issues for Harper, for instance?
No, that's definitely true. It's always a challenge, but it was a challenge for me when I had my own practice as well. But certainly because the vast majority of our patients either have no insurance or underinsured, that's a challenge. And we do get federal funding, but that's a small percentage of our resources. That being said, I'll say oftentimes our patients are surprised, at least both medical and dental, our resources in terms of coordinating care and even the services that we're able to provide. We oftentimes get patients referred even from private practitioners that can't provide the service or don't have the capacity to see patients. So, sort of looping into what Heidi referenced earlier, I think patients are often surprised the type of coordinated care that we provide, and it's often not in the stereotype that I think some people have of health centers.
And just to lay out for people, and we've been speaking around the issue a little bit already here, but what are the advantages for the average patient of going to a community health center? Omar, can you speak to that a bit?
Well, yeah, so I'll give you a prime example. A lot of our patients, will have medical services, and they don't have to be a medical patient. And the benefit there, particularly if they're on medications or the treatment involves, needing to talk with that physician to consider either stopping certain medications or managing the patient differently because of their medical services, it's much easier to have that conversation with the physician right then and there. Also, just in terms of access with the record and the chart, we have access to the patient's electronic medical record. With some patients are not always the best historians in terms of what medications they're taking. Well, we know because they're a patient in-house. And with the systems that we use, both the electronic dental record and electronic medical record, it's all paperless. So we can also forward prescriptions electronically. And it's also just easier for patients to be able to access their records, which often is much different in a private practice setting. And I think a lot of patients are often surprised by that perk.
And Omar, dealing with dentistry, this seems like something people can tend to ignore, avoiding dentists, maybe having a fear of dentists, but this is such an important part of health care.
No, that's true, Laura. I think oftentimes people don't appreciate the importance and the link that oral health has with overall health. There are correlations with heart disease and periodontal disease, also the impact of oral health on pregnancy, and certainly as we get old, and also with diabetes and also with respiratory diseases, across the entire age spectrum, there is the importance of oral health is pretty apparent. For example, with kids, the number one reason of missing school is due to tooth pain, and if that's not addressed, it can affect not only growth and development, but also the ability for kids to be able to focus and learn in the classroom. And certainly as we get older, we're holding onto our teeth longer than we did 30, 40, 50 years ago. And there's a lot of age-related and medication-related side effects and impacts that have on oral health. Unfortunately, oftentimes people think, well, as soon as I get all my dental work done, I'm done. I get a little bit of a hiatus or vacation. Unfortunately, it's pretty much a lifelong need to have oral health needs addressed.
So important for people to have that dental care all through their lives. Now, Heidi, when it comes to the patients at Duffy, have you seen that population grow in recent years or months? Where do we stand on that population, your clientele?
So we have seen a growth in the number of patients that we're serving, but all of the health centers have grown in the last 5 years through the Affordable Care Act. All of our health centers have built new facilities, like the new Harbor facility on Addicks Lane. Our new building at 94 Main Street in Hyannis, CHC of Cape Cod, has a brand new facility, and Outer Cape is doing a lot of work and Island Health doing a lot of renovation work in their health centers. So our annual numbers have increased from about 2,600 to about 3,200 per year. Just based on physical space capacity and efficiency, we're able to see more patients. The numbers of people that experience homelessness on the Cape is a very dicey issue, as you know. It's difficult to count how many homeless people that we have on the Cape. So estimates are anywhere between 5,000 to 6,000 people annually become homeless. But the bigger question and issue for all of us is the number of people that are living in poverty on Cape Cod. And at the height of the recession, there were about 11% of the population, over 20,000 people, permanent year-round residents who were living at 100% of the federal poverty level or lower. That number has gone down as the economy has improved. It's at about 8% now. So there's no lack of people. It's hard for some of our residents and our visitors to believe that we have the levels of poverty on the Cape, but there are plenty of people out there for us to serve.
Incredible numbers. We've been talking about health care on Cape Cod and community health centers. Unfortunately, we're out of time. I've been talking to Heidi Nelson from Duffy Health Center and Dr. Omar Ghoneim from Harper Health Services. Thank you both for being with me here today.
Thank you, Laura.
Thank you, Laura.
I'm Laura Reckford, and this is Sunday Journal.
This podcast is a presentation of Cape Cod Broadcasting, which is solely responsible for its content. Thank you for listening. For more information, please visit us at capecodbroadcasting.com.